The province is the region hardest hit by the 2019 nCoV outbreak, especially the city of Wuhan. The epidemic has prompted the government to lock down the entire city because of increased public anger over the handling of the crisis, especially after a coronavirus whistleblower Dr. Li Wenliang died from being infected with the virus. But public anger in China broke out after the death of a Dr. Li Wenliang, a doctor who was silenced by police when he informed the virus to appear in December 2019. Let's look at the complete news. The number of people who died from the new coronavirus, 2019 nCoV, has reached 909 people in mainland China on Monday, 10 February 2020. Increasing death began to ignite the local public anger that asked the government not to silence them to talk about the plague. This most recent death toll came after an additional 91 new deaths were reported by the Hubei province health authorities. The province is the region hardest hit by the 2019 nCoV outbreak, especially the city of Wuhan. In its daily report, the Hubei Health Commission also confirmed 2,618 new cases in the province. There are now more than 39,900 confirmed cases throughout China, based on figures released earlier from the local government. For global data published on the worldometers.info website, there are 40,553 cases, 909 deaths and 3,322 patients recovering. This new virus is believed to have appeared late December 2019 at a market selling wild animals in Wuhan. The virus quickly spread throughout China and has now spread to more than 20 other countries. The latest data came after WHO said the past 4 days had seen some stabilization in Hubei, but warned death rates and cases could still rise. The epidemic has prompted the government to lock down the entire city because of increased public anger over the handling of the crisis, especially after a coronavirus whistleblower Dr. Li Wenliang died from being infected with the virus. The doctor had been dealt with earlier by the Chinese police for informing the outbreak of this disease. With most Chinese citizens still not returning to work after the extended Chinese New Year holiday, cities including the Shanghai Financial Center ordered residents to wear masks in public. Michael Ryan, head of the WHO Health Emergency Program, said the stable period of the outbreak could reflect the impact of control measures. A WHO international expert mission left Sunday night to China, WHO Chair Tedros Adhanom Ghebreyesus said on Twitter. The mission was led by Bruce Aylward, a veteran from the previous WHO Health Emergency Program. Millions of people are locked up in Hubei in an effort to stop the spread of the virus. The local government is asking people to stay in as many homes as possible, but there aren't enough goods in the shop every time we get there, so we have to go out often, a woman in Wuhan surnamed White told AFP. The Chinese central bank said starting Monday it will provide 300 billion yuan, $43 billion, in special loans to banks to help businesses involved in combating the epidemic. China once reaped international condemnation for covering up cases during the SARS outbreak in 2002 to 2003. However, WHO praises the actions China has taken in dealing with the current 2019 nCoV outbreak. But public anger in China broke out after the death of a Dr. Li Wenliang, a doctor who was silenced by police when he informed the virus to appear in December 2019. Dr. Li, 34, died Friday morning last week, after contracting the virus from a patient. Chinese academics were among those who were angry with his death. Academics wrote 2 open letters posted on social media. The letters demand more freedom of speech. End the restrictions on freedom of speech, reads one of the letters. Beijing responded by sending an anti-corruption body to begin the investigation. The move was an attempt to diffuse public anger. But Ian Lipkin, a professor at Columbia University who works with China on the SARS outbreak, said previous interventions could make a major difference. This virus permeated without anyone realizing it, he said.